السلام عليكم، صبحكم الله بالخير. معكم المهندس أنس الزيد. مهندس. هذا طبعا السي في شورت سي في اباوت مي. طبعا انا ماشي يعني صار لي 15 سنه مع سيباهي و30 years بالاف ام اس فاسيلتي مانجمنت اند سيفتي. طبعا قبل لا ابدا before I start البرزنتيشن، FMS is very challenging يعني from my experience is very challenging for the healthcare hospitals and centers always. Because of different أول شيء إنه different field ما هو healthcare purely engineering. اثنين FMS is not one field, it's actually 4 fields together, so that's also a major issue on it. Plus overall يعني في Arab countries و Saudi Arabia engineering is not as developed as the healthcare في all on all of aspects. So this is we need to keep يعني track of it, and that's why في health for your centers you need to pay more attention to FMS so you can يعني تكون متوافقة مع السيرفيس بروفايدر حق الهيلث اللي you are providing it. طبعا this is facility management and safety, and when we are talking about facility management and safety we are talking about 4 fields. اوكي اللي هم الانجينيرنج الهندسه security safety والبايو engineering. So as you can see it's different 4 different fields by the way, and that's why always FMS is challenging for hospitals and centers, and that's why you need to at least have the basic knowledge in all these 4 aspects so that you can get a successful accreditation from CBAI. طبعا في الامبليتري standard there is 9 FMS standards. طبعا today I will cover 2 things. I will cover the FMS and I will cover radiology. بعد ما أخلص ال FMS هبدأ في radiology. The FMS is the 9 standards which was 52 substandards. Okay. Before I go on detail to these standards, I'd like to just to make sure one very important point. I need you to address it. CBAHI objective or goal is 2 things. A, safety of the patients and safety of the staff and the patients. Number 2 is improving of the quality. So please, before you go and read the standards, okay, and try to comply with the standards, I need you to think about the standard itself. Why CBAHI put that standard? If you understand the objective of the standard, okay, this is not only for FMS, for all the chapters. If you understand why CBAHI put that standard, what are they want to achieve, I think this is 50% of the problem is solved. Because when you understand the objective of the standard, then you can comply with it. So please don't run and try to write it and try to find the documents or training. No. First question is take 5 minutes, 10 minutes, said, okay, what the standards want from us as an ambulatory center? Why CBAHI wrote it? What they want to achieve? Provided that it achieves safety and quality improvement. If you did that, trust me, most of the standards will be easy to achieve and confirm. If you did not understand the objective of it, then you will have an issue of complying with it. So please, this is my advice to you. FMS 1, we have 9 standards in the FMS, as I mentioned. Number 1 is addressing leadership. Now there is 7 sub-standards, but before I go in details of these sub-standards, I have made 2-3 slides for you just to bring the idea nearer. They are addressing 3 things for leadership. What's the requirement for leadership? What do we require from leadership? We require these 10 functions. And that's why when we do a surveying, we need to see these 10 functions are done by leadership. Commitment to safety. There is the planning. And then now when you see all over our standards, we'll talk about plans. And when I will go to the details of these plans, meaning this is the leadership commitment is to have a planning. It's not like haphazard. Every morning we go and we don't know. No, we need to have a plan, a yearly plan, a 3-yearly plan, strategic plan. So we know where are we going, where are our objectives. So this is very important. Organizations. So we need to know organization who's doing what. So that's basically what's the organization, who's the responsibility. Budget allocation, finance is very important. Building culture, there should be a very good culture within the center. Continuous training, it's not one time, continuous, and you can see in the next slides what do we mean by training, especially for FMS. Then we have the safe infrastructure, and this is if Dr. Ibrahim also mentioned that the design for the CSSD, for example, this is also applicable for the whole center. A proper design is give you an ease of work, protection for the patient, protection of the staff, so all are coming together. The oversight is you need to review weekly, monthly, the general incident, accident reports. So this is a major corner of the leadership commitment. Motivation, you need to motivate. Qualified workforce, you need to qualify the workforce, you don't just hire. And communication, which is very important. If you see in our in the general Sibahi is always we emphasize in communication and the writing, prescription, all of that. Communication is a source of errors and mistakes, and that's why we need to make sure that the communication is done properly. So this is the 10 functions of leadership. That's the intent of standard number 1 of leadership. The standard 1 talks about the FMS responsibility. As you can see, unlike the hospitals, the FMS in the centers is saying full-time or part-time, okay? So now he giving you the chance. Now, as a surveyor, whenever the survey is the first question to see the size of your center. If it's a small size center, he will ask for a part-time. If you see a big size and he needs a full-time FMS, I think if it's more than 10 clinics or 15 clinics, then you will have to have a full-time FMS responsible. And by the way, this is, and it's not about requirements by Sibahi only. It's, you'll see the need of the work is you need to have a full-time FMS. And irrespective of Sibahi requirement, when you grow and you go bigger, you will need somebody, engineer, technicians, to make sure that the function of the center is running well. Then that's the need of a full-time FMS. However, if you have a small center, we don't require that. So that's the main side. Qualification is very important. And this is a big issue. We find it in the other sectors, is you need to have the qualified, some qualification by degree, some qualification by training, 3 months training, 2 weeks training, depends on the experience of or the background of the selected FMS officer. Experience is very important also. Training, we need you to develop the FMS. It's not like, because healthcare, engineering is always developing, and you need to refresh and you need to renew this information. Full-time or part-time, we cover that. Positive and persistence. This is a very important positive, and as always in the FMS, especially in the safety officers, I always say you need to be positive, okay? Because always there is a negative from the safety. You don't think the management. No, you need to be positive. You need to improve things. Plus resistance. If you tell me, Engineer Anas, I want to move this wall, I will try to move the wall. I know it's very difficult, but that we need to be resistant if we want to achieve the goals on safety and FMS. Now, FMS covers 7 plans. Okay, this is also applicable on hospitals and applicable on the centers. The 7 plans are facility safety, which is the general safety. The ramps, the doors, and things like that. You need to have the general safety of the center. Then we have the security, okay? And I will mention why we have it done. Then we have life and fire safety, which is the protection from fires. We have the emergency preparedness plans, internal and external. We have the hazardous material, hazmat, also has effect on the center. We have the medical equipment plan, and we have the utility plans. This is need to be covered within the plan for the safety of the FMS. So when we prepare a plan, we need to have something called SMART. What do we mean by SMART plans? SMART plans, we mean it have to be specific. Please, whenever you prepare a plan, you need to be specific. What do you want to achieve? And again, needs to be measurable. As Dr. Ibrahim said, if it's not measurable, we cannot, how can I say it's improvement or very improvement? So it needs to be measurable. For example, you need to make sure, okay, we don't have accidents in 2023. I want to bring down the delay time. I want to do the maintenance, the downtime of the machines. For FMS, we always measure the downtime and the number of faults, for example, for maintenance. This is all you need to be measurable, and you have to put it in your plan. Achievable. We don't ask you for something that's not achievable. Whenever I read a plan, I want to make sure it's achievable within the resources of that centers. It have to be realistic, and you don't be out of, no, we need to be very realistic and time bound. So please, always you need to have the time. I need to achieve this in 6 months, 1 year, 2 years, put it in the plan. We don't mind. And I always said, we are in Sibahi, we are looking to improve safety through conformity. What do we mean conformity? We need to make sure that all the staff are doing the job. Why we are asking for policy and procedure? We want to do the people, even if the people change, they want to do the job in the same way and recognize that deviation. That's why we are asking for policy and procedure, so people can do the same job at the same way. If everybody is doing it differently, okay, then we'll have issues is we don't know what is the outcome or where is the accident and incident happening. So this is very important that, okay, that's why we are asking for policy conformity. We need conformity. Sometimes we don't ask of how the way you want to do it, and this is always happens in Sibahi. We want the center to say to us, this is the way I want to do it, and this is how I trained my people on doing it. So please, this is a major issue is conformity, what we look at it. Training, this is a very important training in the ambulatory centers. Is 3 levels. The first one, individual training. You need to teach them how to use, for example, fire extinguishers and race and passive if you have a big center. Then we have the team training. The team training is you want to see all together for them, and the center, the whole center training. So this is, we need it to be part of your training, that the 3 levels, also I emphasize it, individual level, team level, if it's for 1 clinic or 2 clinics or 1 side, and the whole center training if there is a major disaster or a major problem with it. FMS2 is interdisciplinary rounds are scheduled and conducted to ensure safety. The interdisciplinary team conducts a facility inspection around at least 4 times a year, so it means quarterly, and have to be documented. It have to be in black and white. We need to see it that you did a round, and there is output of that. We found, for example, this area need painting, this area need the flooring needs changing, the door is not closing, so we need someone, and we need to see the action. Okay, the resulting information is documented, as I was saying, and used for corrective action. So whenever a surveyor comes, he wants to see that you are conducting the rounds. There is an output from this round, and these output of the rounds are being addressed and being corrected. So this is the basic requirement of FMS2. Who should be in the interdisciplinary team? Again, it depends on the size of the center. We usually ask one from nursing, one maybe from the medical, and from lab if you have a lab. So there you should be interdisciplinary. So that's also, we need to build the teams so to work and give you different perspective. And this is always, by the way, a case. Whenever I go to a new hospital or a new center, I see things they don't see it because they always, they get used to it. So this is, you need to make sure that when you have somebody from lab goes to the clinic, he will see things you don't see it and you're used to it. So that's very important. 4 times a year, this is a requirement. Overseeing and monitoring, inspection, testing, and maintenance, reviewed and analyzed, proper action to be prevented, and documentation is very important. FMS3 is center environment is safe for patients, visitors, and staff. The leaders ensure the building and the service comply with the national standards. The building and surrounding are hazard-free. The PPM, again, this is very important. I will come now to the explanation of the standard. The maintenance records are kept, and the center has adequate parking. So let me go very quickly about what are we talking about. In Saudi Arabia, generally, we have 2 sources. One now is we have something called the Saudi Building Code. The Saudi Building Code is the code of the country. Now we need to be complying with it. And this is, I want to highlight a very important point. If you have your own building, it's ambulatory, so you'll have as a healthcare center. As an ambulatory center, it's a healthcare level in the building code. Many questions I receive, okay, if you are a part of a building, you are not, you don't own the whole building, you are a part of the building. So the building code says, if there is multiple users, for example, shopping, factory, healthcare, and ambulatory service, the requirement on the building should be on the highest level of these three, for example. And usually, by the way, healthcare and schools are the highest requirement. They are the more stringent requirement for it. So please, whenever you are in the part of the building the whole should have responsibility to have the healthcare requirement for that. The elevators, the access, the exits have to have all this. This is according to the Saudi building code. Again, it's not about if you want to talk to the owners or the landlord. Again, it's the Saudi building code requirement and Baladiyah. So it's, don't put it in yourself in it. This is the code of the country, not my rules. So now this is a very important requirement. It covers also the fire protection as an NFPA, which is the source of the code of Saudi Arabia. Plus, we have another 6 agencies and government Ministry of Health, of course, they have their regulations, the Ministry of Human Resources and Social Development has their, for example, now they have the HSE requirement. It's linked to the number of staff you have. You have the SFDA, you have civil defense, you have the Saudi Engineering Council requirement, plus you have the MOMRA, the Ministry of Municipality and Rural Affairs. All of them has requirements. So you are by this standard required to comply with all of them. And usually we require, if you have the civil defense, we will require MOH licensing, we require civil defense licensing, we require, if there is the MOMRA licensing. So all of that should be prepared and you make sure you comply with all these standards. I know it's difficult, but that's the requirement of the country. Very important, the standard talks about PPM. Okay, if you remember in the beginning of the session, I said you need to think why Sibahi is requiring this standard. So I will explain to you in this one why we are asking, and Dr. Ibrahim also that's talking about the PPM of CSSD, the PPM of all medical equipment, the PPM of all conditioning, the PPM, you will see it also in the X-ray machines. Why we are requiring PPM requirement? Because there is a fact. Whenever you have a lower PPM, and PPM is preventive planned maintenance, okay? Preventive periodical maintenance or planned preventive maintenance means الصيانة الدورية, means you do the maintenance before the defect or fault happens. So you do a PPM on, depends on the manufacturer requirement, 3 months, 1 month, it depends on which kind of equipment, but you need to do a PPM properly according to the manufacturer requirement. So why? Because whenever you have a lower PPM, you will have the corrective maintenance. Corrective maintenance is something went down and you went to repair it. However, there is a fact is whenever you have higher corrective maintenance than PPM, you will have accidents. That's why we always emphasize it. And vice versa, whenever you have a good PPM, you will have lower corrective maintenance, means defects and faults, and you will have less accidents. Why? Because whenever you have a defect, you will run to try to repair it in the middle of the night because you have patient waiting. So this is not the right way of doing it. You have to do a proper PPM on time at your own control. For example, if in the middle of summer your conditionings went down, you run because everybody will not feel comfortable. The whole staff will not feel the patients. So that's why if you did a proper PPM on winter on the air conditioning, you will have a cozy summer, you'll have a proper summer. However, if you do not do the winter PPM on the air conditioning, you will have a difficulty, you will have more issues in the corrective maintenance, and then you will have an accident, which is an incident which we don't like. Also related to that is there is a relationship between the preventive maintenance and the corrective maintenance, and this is very important during the cost. I know many people that don't want to do a preventive maintenance, but in the long run, it will cost you less. This is a fact. PPM scheduling, what we are talking about PPM scheduling, if you have generators, if you have Air handling unit, you need to put for the whole year. You go and review it. The guy responsible on the FMS. If you don't have, you need to discuss it with your contractor if you have a contractor, and you make sure that the PPM scheduling is done monthly, weekly, depends on the type of the machines, the air conditioning, the water pumps, the heating systems, autoclaves, sterilizers, all of that, X-ray machines, all medical and non-medical. Oh, you need to have a full PPM scheduling for all of it. And we need it as a CPAH surveyors to go and see these documents that you are doing a proper PPM on it. Again, for example, for the conformity with the regulation of Saudi Arabia, one example is the ramps, okay, and the parking. The ramps is always an issue for hospitals and healthcare centers and ambulatory centers, is you need to have the proper ramp, one every 12 meter, 1 meter height for every 12 meter. I can see many centers, they have a very steep ramp, which is not acceptable, have to be 1 for 12, for example. The number of parking requirement, this is MOMRA, not ours, this is MOMRA requirement. We also emphasize on it, for example, for hospitals and for the healthcare. FMS4, the leaders develop and monitor the implementation of fire prevention. So this standard is talking about fire prevention, okay, and this is very important in the healthcare. At least annually, once a year, staff are trained for fire drills and evacuation plans. Okay, so you need to train them where to go, what happened. Do you have a sprinkler system? How the sprinkler system will work? What's the responsibility of staff to the patient? They need to make sure that all patients are cleared before they leave the center. So this is a very important, the drills and how can you help? There is a full, then we have the records of fire and evacuation training. We need to see that training is being done. And we will ask the staff, by the way, what do you do if you have a fire? So this is, you need to make sure, not only do you document it, and the staff recognize it and understand it. Then you have the egress routes. So corridors and fire escapes are marked and free from obstacles. Again, if you are in a building, not your building, you are responsible for it. Make sure that there's an egress route, and fire doors and everything is being implemented. Fire system, including the fire alarm, and I will come to the explanation of the fire alarm and the levels of the fire extinguisher. I will come to this fire alarm system and no smoking policy. And now when I say, for example, no smoking policy and procedures, I always say it's the law of the center. شرع المركز, شرع حقه. So whenever, for example, you go to the street, there is a law. Inside the center, the law is the policy and procedure. Whenever there is an accident, the first question we ask is, where is the policy and procedure? And we will try to see the incident. If it's from staff not following the policy and procedure, it will be the staff responsibility. If it was not in that, not in the policy and procedure, that will be the center management issue. So please be careful when you talk about it. One of them is the policy and procedure of no smoking. Okay, as you know, there is a royal decree. There is no smoking on all buildings inside the building. So please, you need to enforce it, and the no smoking signs is there. When we talk about fire prevention, we talk about 4 levels here, and this is very important. Yeah. The first thing is prevention, and prevention, the best thing about it is you have all time to do it. The zoning, the anti-smoking, the culture, building the culture for it. Make sure. So this is prevention you have all time. If you fail in prevention, then your second savior is the detection. Detection is the fire alarm system, basically. So you want to detect the fire, if a fire happens, is the sooner the better. And then you have only a few minutes, by the way, for the detection. So that's why we are requiring. If your detection and you detect it in time before the fire spread, you can contain the fire in small fires. And if not, then we move to a higher dangerous area, which is the suppression area. It means that your fire alarm, the sprinkler system or the FM200 system will start engaging. Means you reach a very late stage. Means the fire is spreading. That's why the suppression system will trigger and will start. The last thing is if after all that failure is the evacuation. You need to evacuation. In healthcare, maybe in the center is lower, but in the healthcare, usually we don't like evacuation because you have patients in beds, you have day surgeries, things like that. So evacuation is our last resource, and I'm hoping very much that you don't reach that level. You need to have it. And one very big rule in healthcare is you need to protect in place, PIP, we call it PIP, means protect in place, means make sure you can protect them through prevention, proper detection, suppression, and evacuation. And there is all those two areas: how you train the staff and how you prepare the design and make sure the system is working through the PPM and things like that. Basically, for fire alarm system, there is two types of systems. There is the addressable system and there is the analog system. Both are acceptable by CBAHI. We don't mind. Most of the new hospital, new centers is addressable. If you have the old one, we don't mind, but just make sure it is working, functioning, no faults on that. We will check the fire panel, the fire alarm panel, make sure there is no faults on it, and we will reset it, and we make sure it. So make sure your contractor or the building owner make sure that the fire alarm system is working. There's 4 types of fire extinguisher. The water type, which is not for electrical, liquids or gases. This is for wood and things. We have the foam, and now everybody is moving to the powder fire extinguisher, which can cover all solids, liquids, gases, and electrical. However, you need to use the carbon dioxide. Why we need to use the carbon dioxide? Because if you have an energized equipment or machines, you cannot use any of that. You need to use the carbon dioxide because it's non-conductive. That's why you have it. Please make sure the carbon dioxide is only used in, for example, in the X-ray machine, if you have MRI or CT, a very specific server room, the one which has energized, and you don't want to waste it. However, if you disconnect the power, you can use powder or any one of the other extinguishers. Drills and training, you need to evacuation drills, rescue alarm, contain fire. Training has been conducted by professional people from your team, and the staff understand how to use the fire extinguisher. If there's a fire happened. Egress routes, the standard covers the egress routes. We need to have the map on the wall, the emergency evacuation plan, where people can go. Maybe you are used to the layout of the building. And by the way, this is very important. Whenever you have a fire, you have a blackout. There is no power usually associated. So many people think, okay, I know the building, I know the location. No, during fire, there is different sets of parameters: smoke, no power, blackouts. So make sure you have the plans ready on the plan, so people are recognizing where is the nearest exit and things, where is the assembly point. You need to have record of the assembly, record of it. Then we have the fire doors. The fire doors, they're properly located, not locked, not obstructed. And this is very important. The fire doors are used between the zones of the fire, if you have multiple zones or you are in the zone. So the fire doors is make sure that the smoke or fire are not going from one zone to the other. So they have to be kept closed, not locked. They have to be kept closed. If you need to keep them open, then you have to put them in the magnetic and link them to the fire alarm system. So whenever the fire alarm triggers, fire alarm systems, the fire doors will lock. They will prevent smoke and fire to propagate from one area to move from one area to the other. So very important, please, we make sure that the doors are working fine. They are closed automatically. The door closer is there. There is no holes. There is no changes on the door. So please make sure all of that, because we do check these things. For the fire science and equipment, this is a very interesting. It shows you where is the level, because many centers, they put it on the floor. Some of them put it too high. You have some nurses is 1.6 her tall, and you find the fire extinguisher is 1.7 or 1.8. She cannot move it. Most of the nursing lady, how many kgs should be suitable for the staff? So all of that should be all done together. FMS for the center is secured and protected from user. This standard talks about the security of the center. Trained security personnel are available in the center according to its size and design complexity. So we do require, this is a very good important. Do I need a security? Yes, if you have a multiple clinics, you need a security, and this is a requirement also, I think, in MOH. The center equipment data are secured. Even if you close at night, you need to make sure you have a security system, CCTV, Make sure, because it's still you're responsible of the data of the patient. Okay, so you need to secure it and nobody is manipulating it. Patient privacy is respected. We will come to that. I will show you why we have this standard. The security personnel, security system restrict access to sensitive and high risk. Doesn't make sense if you have, for example, the day surgery, or you have a private area and everybody is coming in. You need to make sure that there is a security level for it. Patient staff are accessible only to authorized person. For example, medical records for the patients, you need to make sure they are restricted. Nobody can go and check other people's records. All staff were properly displayed identification badges. I know all the centers, they know each other, but still, as an outsider, as a patient, we need to see that you have the ID, okay? So we know that this is, he's one of the employees, and nobody is impersonating as a staff of it, and he takes information for you. So please, all staff properly, they have the ID card for it. Why we have the security, why we have security and safety? If you remember the patient safety bill, the patient safety, Saudi Arabia patient safety, MOH patient safety rights, if you notice that number 3 and 4 are related to security and safety. Number 3 is saying the privacy and confidentiality is protected for the patient. It's one of the patient's rights, and we need to respect that. And protection and safety of the patient. So the safe security is not optional. It's a patient right, and you need to protect that. The security guard needs to be knowledgeable. He knows what he's doing, his limits. Some of them is overdoing it, some of them is underdoing it. So we need to make sure that he respects the patient as visitors. He knows when he can step in and when he steps out. You need to be trained, okay, where relocation, then he can apply, for example, no smoking policy. The dressable, he needs to be dressable. If you have a security guard, he needs to be properly dressed as please. This is if you can see many people putting it inside their pockets, or no, you need to display it so anybody knows that you are employee of that center. FMS-6 is the leaders develop a plan for inspection, testing, and maintenance of medical equipment. Medical equipment is very important. And in most of centers now, either in diagnostic or in treatment, they use medical equipment. An updated inventory list available at all medical equipment. We need to make sure that you have a list of it, and I will show you a cycle of the medical equipment, and you need to monitor all of the time. Medical equipment with special installation requirement, HVAC, or is installed following the manufacturer's recommendation. We make sure that the right temperature is to the medical equipment, the right power coming to the equipment, and it's in the right place. This is very important. So please, whenever you're installing a new machine, right way. The periodical, again, the PPM program is implemented. We already explained that. For medical, we have extra, you need to have it tagged. You want to see the records of the PPM. Or machines that this is out of order. And again, we don't want another staff to reuse it. Okay, so this is very important. Medical equipment is discontinued according to the clear payment cycle. Basically, what is this saying? You need it to the receiving department. Bioengineering, if you have a bio, you need to do a pre-issue check, make sure it's working fine. Then it goes to the users. If it goes to the workshop, either in-house or out, or the vendor, you need to make sure that it's being logged, everything is logged. And that's why we have in the center of the slide is the tracking system. So when I visit you, or anybody in a surveyor visit you, I said, okay, how many machines you have? We have this list of machines, and we checked one of them, and we don't find it. You said, oh, it's with the vendor. No, we need to be logged that it was sent to that vendor for repair on that day, and when it come back, or within, if you have your own biomedical, it need to be logged. All this is to be logged, and make sure. If the machine or the medical equipment is rejected, it's not repairable, it need to be condemned, the record and the file, and it have to be sent away from, we don't want it to be mixed with the working medical equipment. This is a very important cycle, okay? Again, also, you need to have the tag of your center on it, that this is belong to your center, not being lent or from outside. Medical equipment, well, a major issue on it is the tagging. It's here, as you can see, this is a very proper tagging, that this is the check is done this day, next check is the BPM is next day, and if you have anything, then we have the electrical analyzer. We need that to make sure that the machines, all pluggable or electrical machines, have to have electrical analyzer certificate that this machine was tested, because we are putting it in the patient. Again, why we are asking for that? Because you are using it on patient. We want to make sure that anything we're asking, if you, for example, for the electrical diagram, graphic or something like that, CGA, all of them, you need to have the electrical that's been tested on the electrical analyzer. Also warning, do not use this equipment if it's defective or rejected. We need it so nobody misuse it for it. This is for air conditioning. This is a very important slide. This is from ASHRAE, American Society of Heating and Refrigeration. It tells you, okay, many questions I received said, how if I have, for example, minor surgery or dressing room or patient rooms or day case, if I have, what's the requirement for it? This is the requirement of air conditioning. We do, okay, it needs how many air changes, which kind of temperature you need. This is, you need to make sure it's been done and tested and documented. Also, we need it to be documented on it. FMS-7 is the leaders develop and trained on it. The center's, this is the emergency plans. We have two types of plans. The external, internal, we'll come through it now. The center's emergency plan detail how to respond to different emergency and how to minimize the risks in the center. So this is needs you sit down and say, okay, if it depends on centers. For example, if you are sent blackout on rehab or blackout on the building, for example, what should we do if there was a fire on the second floor? So you need to develop. If you are on the highway, for example, your center is on a very busy highway and there was a major accident and the influx of patients came into you. So all of these scenarios you need to develop, and you put your emergency plans according to your location. If you are living, for example, in an earthquake area like Tabuk, and after the Tabuk is earthquake, for example, you need to see is your building is capable of, for example, if you live in, for example, near Al Medina and there is a volcano, you need to whatever your center is, you need to make sure that your emergency plan is realistic to that location. And if you remember, when we talked about smart plans, is you need to be realistic. So some of the centers I read is talking about, for example, if we have ice, water, too much cold. Some of them is not in Saudi Arabia, not doable or not practical. So please be realistic. Where is your location? How is your location affected? And you built your emergency plans, your scenarios, and you train the staff according to that plans for it. The emergency plans is give you the sequence of that trigger the mechanism of how you deal with the meeting. So who's responsible on the emergency clause, the contact person, who giving the authorization, all of that comes. So I will explain it. This is the very important slide. The phases of disaster management planning is always a preparedness. First of all, mitigation. Okay, so if you can mitigate it before that something happened. For example, okay, I am afraid of blackout. There is no power. If I have an emergency generator, I mitigate the risk, because if there is no there's a blackout in the building or in the area, I have my own emergency. Means you mitigated the risk. However, if you cannot, then you have to prepare yourself. You go to the preparedness level. You prepare yourself to different scenarios, and so you can prepare the actual response, what will happen to you, and recovery. This is very important. Business continuity. We are a healthcare. We don't say, okay, we will close. No, we cannot close. It's a healthcare facility. I don't know if you are multiple or single in that town or city, but recovery is very important for us from emergency and preparedness for it. There's two types of internal disaster and external disaster. When you talk about internal disaster, something happened in the center, okay? A fire, you have a water flood, you have a blackout. So some of the clinics have run out of oxygen or something like that. Then you need to evacuate. The evacuation to whom? Where you will transfer. So if your plan is well prepared, you have an agreement with another center that whenever you have a problem, you will transfer it for that one to that center. You will transfer your patient to that. If you have a patient, or if you want to close for any reason, your patient have to continue with services. You need to continue the services. How you'll continue if you are out of it? You have to have an emergency plan that you will transfer it or refer him to another center which you have an agreement with. The external disaster is different. If there is something happen outside your center and suddenly everybody is influx of casualty coming to you. Sometimes it happens. And if there is for example, I remember one center in Medina Road, there was a bus and everybody was bringing the casualty to the center. And the center was over capacity. So you need to make sure if you have influx of casualties, I know sometimes it's not my responsibility, no, but if you are a healthcare, you need at least to stabilize and move the patient as you can up to your extended resources. However, the question here is how you prepared for it, how you prepare your emergency plan, how you call all the people of duty to come to the center if you have emergency. So all of that should be put in your external disaster emergency plan for it. Alhamdulillah, Saudi Arabia is one of the first countries in the world that standardized the codes of emergency codes. So you need to know all these codes. Now, MOH started it. Now also the Council of Health, Saudi Council of Health has also put it in both the private and government. So the requirement now of emergency codes are not only MOH, it's MOH and private sector. MOH, private and semi-private. All healthcare is responsible now because it came not from MOH only, it came from the Council of the Health Council. So you need to comply with it. By the way, it's I think 12, there is 12 codes for it. 9 of them is FMS related. It's about security, abduction, things like that. So you need to know and you need to train your staff that, and please remember 9 of 12 emergency codes are FMS related, FMS owned. So it's not all medical, you have 3 only medical and 9 is FMS. So that's very important that you teach your staff, you need to learn all these codes, what to do during the codes, and some of them put them in the ID. So this is also you ask about. FMS-8, the leaders develop the hazmat. Hazmat is the hazardous material, okay, and how you disposable. At any moment, there is at least 20, 30 in the smallest smallest ambulatory center. I can tell you it's more than 30 from my experience, minimum of 30. If you have a lab, it goes up more like a 70, 80. And whenever your size is bigger, it goes much bigger. So the hazardous material, they keep, again, you need to have a register. The key thing here about hazardous material is you need to know how many hazardous material in your center. If I am in my house, I can tell you my wife is locking the Clorox from the children, the dangerous material, because you have all different types of patients coming, young, people with not a right mental. So you make sure that all hazardous material is, where is the hazardous material, the quantity you have, and they are properly saved. So please, the control. Plus, we require you as a CPI, you always work to minimize hazardous material. So if I have this year, for example, 60 hazardous material, I want to see that your next year, this should be in the hazardous material plan, that I want you to see next year, I want to have 55 hazardous material. If I have, for example, this year, 50 cylinders of, for example, oxygen. Oxygen is a hazardous material, believe it or not, because of 2 things. It's oxidizer and it's under pressure. So all gases under pressure is hazardous material. So you need all to minimize always the hazardous material. Fire extinguisher, believe it or not, is a hazardous material because it's under pressure. Any gas under pressure is a hazardous material. You need to log it in your register, and you need to know exactly how many you have it in the center. You need to train your staff how to deal with the hazardous material. Hazardous material wastes are controlled, both the waste, and Dr. Ibrahim already covered the waste. Here, by the way, the bio waste is part of the hazardous material. Okay, one of it. If you have seen the categories, one of the categories is the bio waste. Already Dr. Ibrahim covered it. The center exerts continuous effort to reduce hazardous material. This is what I was telling you. If this year you have 60, please try next year to have 58. Either you're getting the replacement material, or you can have different way of using the material. So we want to see quantity and quality. So this is we need always to have. I will come a special slide for that. Waste disposal is done effectively in manner within the facility throughout the authorized contractor. This is the law of the country now. Fire-rated cabinets are used for flammable hazardous material. So again, hazardous material, you have to have a register, a kitab, and how many hazardous material you have. Usually how we do it, we ask for example, the lab, the clinics, the nursing, the maintenance, all of them to give us the list of them. We combine that list. We get the SDS, the safety data sheet. We all put them in one file, and we always start monitoring them. How many quantity? If there's quantity exceeding the requirement of usage, you go on as a management of the assessment required, you need to minimize it. It's not about economical, also from hazardous weight. We don't want to keep hazardous material inside, for instance, for the fire or misuse by different people. Here again, if your supplier brings you hazardous material, you need to register it when you receive it. If you have a user department, you need to monitor it and you register it. If there is a waste, you need also to log it and make sure how much. So when we visit you in Sibahi, I will ask you, okay, can you give me the hazardous material registry or list? You should give me a list of how much the minimum requirement, where is it, and who's responsible of it. So all of that, the minimum and the maximum requirement, and we need to see that, including the biomedical waste, by the way. You need to know how much exactly you are giving the biomedical waste outside. This is one of the, they call it the NFPA diamond for the hazardous material. It basically tells you the classification of hazard, how hazardous. It covers it from 3 different angles, from the health, and reactivity. This was very popular in the 90s and the early 2000s, the NFS, the globally harmonized system, which I will show you, NFPA. It tells you if you have, for example, methanol, it has a health hazard of 1. However, the flammability is 3, which is very high serious, and the reactivity is there is 0 reactivity. And the 4th square is how specific hazard, how you treat it. This is the different icons for using it. This is the GHS. This is now everybody is using the globally harmonized system. This is standardized system of classifying the hazardous material. It's sponsored by United Nations, so the UN, okay, adopted by many countries. And believe it or not, even the US is going away. They're using the OSHA. They're moving back to GHS because the United Nations saw that hazardous material is moving from one country to the other with different classifications. They came with this classification. So I am recommending that you follow the GHS. The GHS comes in 16. This is the entries of the safety data sheet with pictodale, which we can pictogram, which tell you exactly for it. So let me show you if you have it. No, I'm sorry. There is a pictogram for all of them. You need to make sure that the materials you have, if it has one of these, it's back on in your registry, on your hazardous material registry. FMS-9 is the last one, is the leaders develop policy and procedure for the safe use of medical gases, okay, for the compressed gases. So now the FMS-9, the last one, is about medical gases. The document highlights the use of cylinders and transporters. Okay, how you transfer cylinders. We make sure that the staff is not being, some of these medical, even if it's oxygen or nitrogen. Nitrogen is an inert gas. There's no fire. Well, because it's under pressure, if somebody clipped or broke the valve, it can. If you see, there's many videos, and some of them is like a rocket, like a bomb, really very dangerous. So make sure the transportation is being done. Plus, if it's oxygen, is more because it's a fire accelerator. Plus, it's oxidizer. This is very important. The document emphasizes the cylinder storage well ventilated. Where you store it, we will check where you store the cylinders. The document describes how to secure the cylinders by positioning. I will come to that. I'll show you one slide about it. The document ensures the timely replacement. We don't want to see that one day in the morning, the nurse comes to you or one of the staff, wallahi, we are out of oxygen, for example. This is totally not acceptable. So you make sure that you have also a backup and enough quantity for the operation of your center, and plus some standby. Centers equipped with biomedical gas follow the regulatory body testing and safety requirements. This is some of the cylinders. This is something we see a lot. See, he's using. This is not right way of transporting oxygen in the back of the pickup trucks. This is not acceptable. It have to be in a secure cylinders or special vehicles. Plus, the color coding of the cylinder should be proper, and the writing of it and the cover. So this is some of it. There is 4 medical gases, and if you are using piped medical gases, the oxygen, the vacuum, and the medical air. This is a very quick responsibility if you are using medical gases for certain the piped medical gases for certain levels of centers. If you are too big, you should go for piped medical gases because it will be more economical for you, and safety is moving cylinders. Too many cylinders is dangerous. So piped medical gas will be your viable solution for it. So there are 4 gases which is used is the vacuum, the oxygen, the vacuum, the medical air, and the nitrous oxide. Okay, and they come from 4 different sources. So the oxygen source comes from the cylinders. Some of them use the liquid oxygen tanks, and some of them use PSA, which is oxygen. It takes it from the air and compress it, and get it. The medical air comes from the cylinders or the compressor, and you need to make sure you have the dryers and filters for it. The vacuums always comes from the vacuum pumps, okay? And the nitrous oxide comes only from cylinders. So this is the general. We come and check it. If you have a piped medical gas, you have to comply. There's 2 standards in existing now, regulatory asking for them. There is the HTM, the Health Technical Memorandum, which is the British, and there is the NFPA 99, which is the American one. But we need to see if you are ambulatory center, you are using biomedical gas, you need to tell us which system you are following. We don't mind as a CBI. If you are following the HTM or you are using NFPA, but don't mix them, please. If you are using HTM, the whole center has to have HTM standard, including the outlets, the backup, all of the quality of the air, all is different, by the way. If you are using NFPA 99, you have to all following it, including your medical equipment, because this medical equipment will fit in your outlets. Make sure they are fitting together. This is something we check, by the way.